Hi guys, it's Adell and I again for Hypermobile Yogis, and we are so honored to have Tom here. We found him on Instagram and we were totally blown away by his content. I'm someone who obviously trained in physiotherapy, so I'm always looking for people who share amazing different exercises and tips and just like smart ways to help people feel better in their bodies. And I personally feel like Tom does this so well. I just love your grid. I love all the content you're putting out there, and we thought that you would be the perfect person to help educate us on just like any tips and tricks on how to live in a hypermobile body better and really get the most out of it. I mean, we've just found out that you work with Cirque du Soleil, so we know you have a lot of experience working with bendy people. So yeah, Tom, would you mind just introducing yourself and telling our followers a little bit more about you?
Sure. Well, yeah, thanks again for having me. It's like I said, it's been really cool to connect with so many different people on Instagram and social media in general. And yeah, just it's a topic that I think is interesting. And, just background wise, I'm from the United States, grew up in Montana, which is a really cold state. And I trained initially in kinesiology in my bachelor's degree, and then came out to Southern California where I'm at now for physical therapy school. And since graduating, I've mainly practiced in orthopedics and a little bit in sports medicine, but mainly sort of orthopedics. And growing up, I should mention before, I think which will play into this discussion, I was a gymnast and a martial artist all through from pretty much, I was into the Ninja Turtles when I was like 10 years old. So that's what got me going.
Who was your
so yeah, I was a big Raphael fan.
Me too.
He's the best. Yeah, totally. I actually did the size for a little while because I was so into him. But so I was big into stretching. I used to be able to do the splits in high school, across chairs like Van Damme style. I used to be able to do all this stuff. But
Awesome.
so I was really into it, and then into physical therapy and went that direction. And then for a while, just kind of worked with normal, sort of like the average population, and did that for a few years, and then went on and worked for Cirque du Soleil for a while. And the show I was on, they create all their shows in Montreal, so I was there initially, and then it was a show that was going to be a residential show like the Vegas ones, but in LA. And it had a lot of dancers. There's some former Olympic gymnasts and trampolinists, and so it was really neat to work with them, and of course a ton of hypermobile people. But it fit with my background, and so I did that, and then came back, and now we're in Santa Barbara, California, about an hour and a half north of LA. And for the last 7 years, I've mainly been teaching at a small college here in their kinesiology program. So I taught biomechanics, and I'm really into pain. So I did a pain science class and a therapeutic exercise class. And so I'm sort of now transitioning out of that. I'll probably still kind of teach half-time, but transitioning a little bit back to a split between sort of a half split of clinical practice and teaching, and then all the rehab science stuff online. I mean, I love writing about this stuff and hopefully providing useful things to people. There's so many people in the world who do not have access to providers but have a phone and can do exercises. So that's been a really cool thing for me in doing all this. So
yeah, RehabScience is Tom's handle, guys. So if you guys are interested in going to have a look at his Instagram, it's really, really great, this content he puts out.
Thank you. Yeah, so that's that's a little bit, I mean, other stuff. My wife, I met in physical therapy school, so she's a physical therapist too. And we have 2 girls. My oldest, Reese, is about to turn 8 next week. And then my younger one, Taylor, is 5. And they're just awesome. And I grew up with all brothers, so this is so far better. I've heard. We'll see what it's like in high school, but
so far so good, huh?
Yeah, so far so good. Yeah, so that's kind of the background, and that's a little bit about me. I think that
when you spoke about working with the hypermobile people in Cirque du Soleil, can you give us a little bit of insight into what you discovered working with this demographic?
Yeah, let's see. That's a good question, because I think I've been around hypermobile people for so long. I'm trying to think, sometimes when you're around something from a young age, you just get used to being around it. I think there's some interesting things about Cirque du Soleil that aren't always just hypermobility related. That is a really amazing organization. It was a really neat position, but it brings together so many people from different areas of the world that actually pain was really interesting. circ because of cultural influences. And
Wow.
some people would talk about having pain and some wouldn't talk about having pain. And I think a lot of people, I think there's this sort of notion that being hypermobile might predispose you to injury, or maybe that moving too much means you'll have pain. And I think that's an interesting thing to see in an organization like Cirque du Soleil, where you can have people who don't fit within the sort of normal movement, what textbooks would say, but they function really well. I mean, better than most of us, right? I mean, and often that hypermobility, it doesn't necessarily mean you'd have that something would be dysfunctional or you'd have pain or something like that. So I think I see a lot of that on social media where people sort of assume that if you're not within this like narrow, like normal's variable, we're all different. And, but if you're not within some sort of normal, whether you're hypomobile or you're hypermobile, that you will have you might be dysfunctional in some way and be more prone to pain. And I mean, for sure being hypermobile brings its own unique characteristics, but I think it doesn't necessarily mean that something's wrong with you.
Definitely.
And actually, it has a lot of advantages depending on what you're doing. I mean, I for the last few years have been doing Brazilian Jiu-Jitsu, and being hypermobile and that is really helpful. People can't submit you because your shoulder doesn't get tight like someone else's. So, and yoga and I mean, dance and martial arts and gymnastics, all those things, I think if you can control it, it can be a real asset. So
definitely. We just feel that maybe the right message about how to control it hasn't really been put out there.
Sure.
And that's why we're trying to do these interviews, is just gain a bit more clarity, because especially in the yoga world, we've not really noticed great advice being given to people about stability and knowing how to control that range function.
Or certainly there's not even any kind of like message that's regularly put out there that differentiates that, some people are hypomobile, some people do kind of fit into like whatever you want to say is normal, and then some people are hypermobile, and different people will need different ways of practicing. And so these are all kind of just messages that we're trying to rethink
and package up in a way that's really digestible. So when you were working in Cirque du Soleil, did you have like more even afterwards or before, really whenever in your career, when you're maybe just working with a normal person, let's go with normal people and not Cirque du Soleil for a second. Are there any key features of something that you think that they should understand about their bodies, or things they should alter?
Yeah, I think there's just sort of basic things that probably most people should incorporate for just physical health. And I am a huge proponent of resistance training, whether that's your body weight or other tools or whatever. But I think there's a lot of good research on injury reduction and just being stronger. If your musculoskeletal tissues the greater their capacity is, the less likely you are to have them fail. And then I think sometimes flexibility type training there's one study that a lot of people cite where resistance training was more powerful in terms of reducing injury than flexibility training. And so sometimes I see sometimes people saying, oh, don't bother ever stretching, and I think that's sort of a dangerous thing to say, to just make that happen on social media. It's just these broad generalizations all the time. And but I know for me in my own life, even though I was flexible, flexibility training was really useful and important in my overall health. And I think for some people, it doesn't necessarily have to be physical health. I think there's a lot about flexibility training that could help, and from a mental health standpoint too, just sort of being aware of your body and just sort of almost being in a meditative state while working with flexibility. So I think, for just the general population, there's a lot of people that we sometimes call motor morons, but where they just don't know how to control their bodies. I think if you didn't grow up as an athlete and you weren't taught that, you just meet so many people from the general population that have no awareness of things like their shoulder blade. I mean, certain joints like their scapulothoracic joint, they have no idea that that's even there. The backside of their body doesn't really exist. And so I think movement awareness is huge. I think strength, resistance training, whichever kind of method you do to sort of increase in that way. I think flexibility training for certain people can be really useful. But I think those are just sort of general things that I kind of think of. I sort of think about people's motor control, what sort of strength do they possess, what sort of, what's the capacity of their tissues, and then what's their mobility and flexibility like. So I don't know if that answers that, but those are kind of general things I think about.
Yeah, I mean, I think it kind of comes back to that whole everything in moderation advice. Like, yeah, don't do, like, whoever you are, like how flexible or mobile you are, don't do just flexibility training or just strength training or whatever, like mix it up, right?
Totally. I think a huge one too that I see talked about more and more in the research is the volume of sort of stress you put on your tissue, the volume of loading and things. And that probably applies more to, I don't know that flexibility and mobility kind of training would fit into that so much because it's a little more passive and your tissues aren't loaded so heavily. But I mean, there is some load, but with resistance training and running, I mean, anything where you're putting force on your tissues, I see more and more of that sort of discussion of how do we help people manage the load that's being put on their body so they can, right, because our bodies are amazing in their ability to adapt if you apply the right dosage of movement. And I think that's something that maybe is kind of newer too, and thinking about there's not really good or bad movement. It's more probably about the dosage and like you said, Adell, sort of mixing it up and not having maybe the same types of stresses all the time and incorporating other aspects of movement.
Yeah, because like this is it. Like you said, the body is so adaptable, and the more variety of like stresses that you give the body to become resilient towards, the more resilient overall it's going to be. Exactly.
Yeah, that concept was ingrained in me so much in martial arts. I think martial arts it does such a good job. And I see aspects of this in yoga and other, practices now, but yoga wasn't, like when I was in high school, yoga wasn't popular. I never heard about it. In my hometown, I don't even think there were yoga studios.
Yeah.
So it's just, so it's neat to see that. But at that time, martial arts, for me, when I look back on it, really did a good job of incorporating all these elements of movement. I think that help move people towards sort of an optimal state of, sort of physical movement health. But as a kid, I just took it for granted. It's just what I did. But now looking back on it, it was such a good system. So yeah, it's cool to see more people involved in things like that now, practices where it incorporates all these different sort of characteristics of movement and things. So
I think with the big thing that Adell and I are just perhaps, well, we both struggled with actually is we came from yoga, and perhaps there wasn't enough education about the importance of biomechanics within your yoga practice. Yeah. So we didn't know our inner arches of our feet were collapsing. We didn't know we weren't activating TVA. Our serratus was non-existent, and we were doing these really advanced movements like handstands, a lot of push-ups, a lot of back bending, really deep, without that fundamental base to really support our practice. And this is when our injuries and our pain started coming in. And with the reason we started this whole page is to change that culture. I'm not sure if you see any yoga people coming in with consistent injuries in your clinic, or if you have any kind of insight that you could share in terms of the yoga world and perhaps what we love and maybe what we need to kind of alter. Because I think for us, we really need to find smart people like you, maybe either going, hang on guys, maybe you're not on the right page with XYZ, or actually what you're saying is 100% true. So yeah, where do you stand in terms of yoga?
Yeah.
What kind of thing are you seeing in your clinic?
Sure.
And yeah, just so we can hear your opinion on that.
Yeah, I think actually most of my interaction in terms of with the yoga sort of population has actually been, I taught for 6 years for a group called Red Cord. It's a Norwegian suspension training system. It's sort of like TRX, but on steroids. It's you suspend people, it hangs from the ceiling, and you suspend people in different positions to activate different muscles and work different planes of movement. But it's very biomechanical, and Norwegian physiotherapists who are trained in that, that's their whole movement assessment system and way of treatment. And so it's this big red apparatus that hangs from the ceiling that you sort of, strategically position people in. But I taught lots of different professionals, but I think some of the interactions that stand out most to me are when I there were certain courses that were geared at sort of trainers and yoga instructors and Pilates groups and the people in the Pilates community. And I think the thing, like you were saying, the sort of biomechanics piece of it, I noticed that that was something that they really got excited about and felt like it would be really useful in working with their clients. And I often heard that they didn't really have a formal sort of system for analyzing movement. And it was sometimes just like, there was all these exercises, but what would you look for in movement? What would go into that assessment? And maybe things have changed, but that was sort of, I think they felt like that would really help them sort of decide on what exercises would be best, which exercises would be most therapeutic, or help uncover sort of impairments the person had in their body. And if they could be used and sort of organized in that way, maybe they could really lead towards, like I say, optimizing movement or reducing injury risk. And so, it's such an interesting thing, actually. I used to really think about things like, oh, how do we activate serratus, or how do we, the TVA, that was such a big one that kind of started in the early 90s. And that, it's interesting, that whole area, there's sort of a big group of people that are sort of pushing back against that a little bit, and saying that we really need to train movements and not muscles. And so there's people who come from both schools of thought on it, but it's kind of interesting to see it changing. I think there's a lot of good things in that sort of approach of, hey, let's isolate sort of real specific muscles and groups and things like that. And also let's think about how can we just grade movements and train movements. And I think sometimes the injuries happen because, if you think about exercises that target serratus, for example, they usually are, most rehab related sort of exercises are less, they're sort of regressed versions of other exercises. The load is lighter, maybe even body weight is reduced. You're offloading the person's system. And I think that allows people to tap into areas that maybe they didn't previously have control of, and so I wonder sometimes if those approaches are so helpful, not because you're so much you're targeting that one little specific muscle, but maybe because you're helping regress the person to a point where they can find and become aware and recruit that sort of target that area of their body and then bring it into more challenging movements, and I think, so anyways, I've been kind of thinking through this the last few years, and I think that's when I was working with people from a yoga background, I think that was what they appreciated about the kind of physio perspective of breaking things down and isolating really small areas, that then they could use those exercises to really target something on a more specific level and then integrate that into more compound, larger whole body movements. If that makes sense.
Yeah. So the way I think of it is like, if somebody is, say, to continue with the example of the serratus, if their serratus is just not firing, there's just no connection between like the brain and that muscle, then those isolated movements could help build that connection. Then the person would go into bigger movements, maybe consciously thinking about it, like, oh yeah, now I know how to engage it, I'm going to get it engaged. But slowly then over time, they wouldn't have to think about it, and it becomes the way that they should be moving, right? Is that what you're saying?
Totally. I think so. That's exactly what I'm saying. And I think there's a lot of value in knowing, sort of having strategies for meeting somebody where they're at functionally. And, that means knowing I think there's so much focus on progressing people into really hard things, and sometimes not as much focus on how can we regress people. And maybe that sounds maybe the word regress sounds negative, but it's just finding people where they're at. And like you just said, helping them create that sort of mind-body connection into areas of their body that maybe they aren't so aware of, and then they can tie that into more complicated things later. But I think sometimes people jump into really difficult things without that sort of initial training, that foundation. Yeah.
I mean, I did dance since I was 3, and then I started doing capoeira, which is very complex movement patterns, and then I joined yoga, or like they kind of happen around about the same time as each other, and I just had no stability, and yet I was doing almost backflip movements, and I was spinning on my head. And I mean, the movement patterns that I was doing were insane, but I have no idea to this day how I was making that even physically possible in my body. And of course, as you can imagine, I had a lot of problems. So that whole regression thing for me was incredibly powerful.
Yeah. Yeah. I think there's a lot to be said for, I feel like so much of movement health boils down to like, one, do you have sort of a strength foundation, which strength is partly your muscle fibers. And you're right, what are your muscle fibers like? But also, what is your neuromuscular sort of connection like? Yeah. And I think that's a lot of what we're alluding to here is, you need to have that strength and that tissue capacity to help prevent injury. And again, part of that is what is the actual sort of physical characteristics of your muscle fibers, but also how does your nervous system communicate with your muscles? And I have I have a couple of high school kids I'm working with right now, and the boy is 14 and he just grew like 8 inches, so he just is, which I probably should convert to centimeters, but, so, but anyway, he's grown a ton, and it's just interesting to look at kids that age, and it's so apparent how hard it is for them to control their bodies when they're changing so much. And, so that's been a big focus for us, is not only getting him stronger, but just teaching him motor control and how to control that strength. And I think sometimes it's one thing to be strong, but if you're really looking at injury prevention, it doesn't do a whole lot if you don't know how to control that strength. I think this is huge for people who are on the hypermobile side of the spectrum. Because they're going to have, in my biomechanics class, I talk a lot about stability in the body and sort of how it's organized. And there's a great researcher named Punjabi that put out this spine article where the functional stability was broken down into 3 subcomponents. So your nervous system, your muscular subsystem, and then your osteoligamentous subsystem. And then you can think about your nervous system and your muscular subsystem, the ones that we have voluntary control over, as sort of like your active subsystem. And then the osteoligamentous system, all those passive structures, would be your passive subsystem. So things like ligaments, the joint capsule around our synovial joints, spinal discs, the meniscus, the labrum, those things are all sort of more on the passive side of our body. You can't think I'm going to contract my meniscus. No. You can't do that. So it's just there. And so hypermobile, if you're on the hypermobile side of the spectrum, if you think about those 3, the passive restraints, the osteoligamentous system, is going to provide less influence instability, because if you're hypermobile, probably a lot of that mobility is coming from the joint capsule around your shoulder, for example, is more mobile, so it allows you to move farther. So that joint capsule is going to be less of a restraint to protecting you from dislocating or something. So you have to rely more on your active subsystem, those neuromuscular elements. So I think that's an important thing for people. Yeah, what's that?
It's hard for us because we haven't got that collagen, and that the neuromuscular thing is gone because the proprioception's wonky. So it's like a big task to get it. But once you have it, then you're a superhuman, and then you're like Cirque du Soleil and like Olympics.
Exactly. You're super mobile, and you can control it, and you have the strength control and the motor control. And so you think about those people are amazing when they get to that level. It's mind blowing. I mean, you can't stop watching them move. So I think.
Can you share that article with us?
Sure. Yeah. You want me to? Yeah, I'll send it to you. Yeah, it's a kind of a 2-part series on
papers here.
Yeah, it's a great one. It was a research article, but it was sort of more of a discussion on the spine and how we stabilize it, but you can apply it to other joints.
I would love to read it.
Yeah, totally. Yeah.
My geek would love it.
Yeah, can nerd out on that. Yeah. So I don't know I think that slide is one of my favorite ones when I talk about joints in teaching kinesiology students, because I just think it's such a great visual, and I can send you that slide from his article too, but just how we think about our active subsystem and our passive subsystem. And if you're more mobile, your passive subsystem is probably providing less restraint to movement. So you've got to spend more time focusing on your neuromuscular, that active subsystem, to control things.
Oh,
Yeah.
I love how you describe that, because we often, that's kind of our message, but we've never articulated it that good.
Yeah. Yeah, I'm going like, okay, I have a new way to describe this now.
Yeah.
This message that we've been trying to.
Yeah.
Love this.
Yeah. So speaking of messages, another message I wanted to ask you about is like, so we've talked about kind of like yoga into into physiotherapy, but also we've come across a lot of hypermobile people that have been told that they went to physiotherapy for their injuries and they were told to stop doing yoga. And so and it seems that this is a common message that physios and other like healthcare practitioners are giving to hypermobile people, like, okay, you're prone to injury, so therefore don't move, which you did actually talk a little bit about at the beginning. And I just wanted to ask you, like, is this something that you've come across? I mean, I'm sure you don't do it yourself, but is this something that you've come across in the world of physiotherapy?
Yeah, I think I hear it where I'm at now, because California, Santa Barbara is sort of like LA in that there's a movement is really a priority for people here. I don't hear it quite as much here anymore, but I know what you're saying. And I've heard it in lots of other places, and I've heard medical professionals say that, physios say that. I still think there's kind of this, especially in the medical world, there's still a tendency to tell people not to move when they're injured or recovering from something. I don't say that at all to people anymore. I mean, maybe there's a real temporary period of rest to let things calm down, but generally you're trying to get people to move. And I think that physios saying that about yoga must be that they don't understand it, and they don't understand, things we don't understand. Maybe we probably wouldn't recommend, and they're more, maybe they have a tendency to be worried that it's going to hurt someone. Because of thinking about those initial sort of movement aspects we talked about of motor control, mobility, and strength, and all these working together, I have a tendency to think yoga, if the person finds the right teacher, is one of the best ways, because it's the most similar thing to me of my martial arts background. So I actually think it's, and maybe when I was in my first couple of years of practice, I don't think I've ever said that to anyone, but I might have had more of a tendency to think that when I didn't know much about yoga. And I think as it becomes, I think it'd be hard for something to become so popular if it was hurting everyone. You know what I mean? Like if it was really a problem, how would it be so popular? And now it's just everywhere. And so I've had more of a chance to do it myself and to work with people from that background. And I think it really does a great job of combining all these aspects of movement. But it's like everything else. Like there's bad physios, there's bad teachers of everything.
So true. Yeah.
You just have to find the right person, I think.
And what would you say things are that the student should look for?
I think you just can't beat personal attention. I mean, I think people who have experience, who are going to pay attention to, obviously, just to what's happening to the person and be communicating with them. I think that open dialogue, which is kind of a no-brainer, that's for everything. But I think also having somebody who maybe thinks like we're talking about, and kind of thinks about, sort of has a good system for organizing movement sort of categories within the body, so sort of mobility, flexibility, strength, motor control, and maybe they're not using those words, but they have a way of sort of organizing it and thinking about maybe where a person has deficits, and then figuring out how they could design exercise to improve those deficits. But you have to have that personal attention in the first place to, even target those things. So I think those kind of things would jump out to my mind. And that's not just yoga. I mean, that's anybody who's helping people with their movement health. I think that's sort of I would hope they would have those sort of, they would have that sort of system of approaching someone.
Yeah. Well, like you said, there's bad physios.
Totally. There's bad of everything. Yeah. I said a lot of stupid things. I mean, I've been a PT for 12 years and I said a lot of stupid things when I was early on. So
I think one thing that makes a good, like whatever it is, physio, yoga teacher, doctor, like teacher, like parent, whatever you are. One thing that makes you good at that is your ability to say, I don't know everything, and I'm going to continue to learn and grow and admit my mistakes and learn from my mistakes. And so, yeah, I think the danger is when you're like, I know everything.
Big time.
Yeah, I agree. I couldn't agree more with that. There's this whole Dunning-Kruger effect. Have you heard of this before? Where if you look at, it's sort of this almost like a U-shaped graph, but and it sort of compares how much someone knows with sort of how much they think they know, and people who don't, it's so common to run into people who don't actually know much about something, but because of that, they don't know what they don't know. And so they're very confident. And I think that's it's so true. I think we should all, there's so much uncertainty in human movement. And especially when you start adding pain. I mean, pain is so complex.
I'd love to ask you more about pain, actually.
Totally.
When you're done talking about this, I'm really curious.
Yeah. I mean, that is an area that's, I love, I just kind of geek out on. So, but there's so much uncertainty and pain, and knowing, it really frustrates me when people claim they know what's causing someone's pain without a doubt. But I think, that Dunning-Kruger effect, when people don't know much, they think that they know a lot. As we learn more, we go down into sort of this chasm of feeling like we know nothing. And then probably by the time you're like a senior practitioner or a teacher or whatever you do, then you start to feel like, oh, I kind of know something now. But I think we should all be striving to be lifelong learners. And some people seem to be, I think some people feel like if they tell someone they don't have an answer, that means they aren't good at what they do or something. And it's something hopefully more people can become comfortable with, because it definitely doesn't mean that. Actually, I've had lots of students over the last 7 years that in surveys say that they appreciated when I was honest and didn't know something and then found the answer. So
yeah, I think we need to learn that there's nothing wrong with saying, that's an interesting question. You know what? I don't know.
Yeah.
But I'm going to find out and get back to you.
Yeah.
Exactly.
Or just, I don't know.
Yeah. People don't seem to take that negatively. I mean, I think especially if you actually come back with an answer. I mean, if you never come back again, then it might look funny, but if you come back with an answer, they really appreciate it. I mean, it looks like, people understand that you're dedicated to them when you do that. So
people have such good bullshit detectors as well. They're just like, this person is talking out of their ass.
Exactly. It's so true. Yeah. Those know-it-all types. Yeah.
Hey, can you talk to us more about the research that you're looking at in terms of pain, and any kind of just insights that maybe you could share, especially with our hypermobile population, if you've got anything that you want to share with that? I'm really excited to hear it.
Yeah, I think, like I said, pain is really complex. I mean, pain now is approached from this biopsychosocial model, and so usually when you hear people talk about injury, for one, people think of injury and pain as a direct correlation, and that's not true, right? There's lots of people there's lots of MRI studies where you take people who don't have pain and do MRIs on them, and they have something that would be considered an injury but don't have pain. So, meniscus tears, disc herniations, labral tears, it approaches almost 40 to 50% of the population in some studies of people who have these things. And so I think questioning, are those really injuries? Maybe they're just changes, sort of like sometimes we compare it to wrinkles on our face. We don't think of wrinkles on our face as being degeneration of the face and some disease, so maybe they're just changes in the body as we get older. So I think that's one thing, separating injury from pain, thinking of those things as distinct things. And I think going back to that biopsychosocial model, we have a tendency often to blame tissues all the time for people's pain. And I think it's really important to think about these emotional and psychological triggers, and what you're doing with these kind of interviews, I think are so powerful, because beliefs are a huge part, of pain and what people think about their bodies. And these kind of talks, I think when you spread them to these large audiences, can help people. Hopefully it can kind of change some of their beliefs about their body and what it means to have an injury or to be in pain. And, those beliefs are shaped by medical practitioners, by friends and family. When you're a kid, your parents shape your beliefs about pain big time. So I think about this all the time with my girls, of not overreacting. I just try to be conscious of what beliefs do I have about injury and pain that I might be passing on to them and affecting their future in that way. So, when it comes to hypermobile people, I think, if you're hypermobile, So I teach a jiu-jitsu class at the college, and in jiu-jitsu and Brazilian jiu-jitsu, you're twisting people's joints until they tap, so if you have a really hypermobile shoulder, for example, and somebody tries to rotate your shoulder until you tap, you can go a long ways, and it can be advantageous because people can't tap you out. I think the thing I've noticed over the years with people who are hypermobile is that line between I'm okay and I'm injured comes really fast.
Oh my God.
And so
Genius what you just said.
It's like they'll push their joint really far, and I know that their end range is at a different spot than the person of average mobility. So I'm okay with them moving through their full range, but you can tell when they get to the end of that range, when you can sense it coming, it feels like this really quick transition between my joint is totally fine and all of a sudden my shoulder is dislocated.
Oh God.
Whereas I think the person with sort of average mobility, they will feel a windup in their tissue, in those passive subsystem structures, and probably in their tendons. I think they'll get more feedback from their system as it's winding up, and they have it's almost like they have a longer warning before something happens.
Yeah.
That's so great that you shared that, because I think that especially when you're in a yoga class can give you so much awareness in your body. Just knowing that sentence that you've just said, that the line between me feeling okay and actually having a really serious problem is quite small. So don't even go there.
Well, yeah, and it's especially relevant for whenever you're getting an assist or an adjustment by a yoga teacher. And that's happened to me before, where the yoga teacher, like, no disrespect, is saying, like, is this okay, do you want to go deeper? And I'm like, yeah, and then all of a sudden it's just like, oh, no,
get off me. And then it's like very sudden for the person. They think we're crazy.
Yeah, I think that's so true. And certain joints are going to be more prone to that than others. I mean, I think the shoulders are really like that. Probably people have really hypermobile spines. If somebody were to kind of move them into a position, the other, and maybe some other joints, you might have good examples for some of the other joints, but the shoulder just sticks out to me so much for that. People can have such hypermobile shoulders, and it can just be it's just a naturally an unstable joint anyways, which sounds negative, but we need that to move our hand in space.
Yeah.
And so, we talk about this with joints all the time in the body, that if a joint is really mobile, it gives up stability. If it's really stable, it usually gives up mobility. So it's like the knee acts, or like your knee or your elbow, they both sort of act like hinge joints. They don't move in all three planes like the shoulder and the hip. So they're very stable, but they give up some mobility, and your shoulder is really mobile and it gives up some stability to allow you to do that. And so I think those joints that have a tendency to be more on the mobility side of the spectrum, and if you're somebody who's hypermobile, you have to really know your body and be careful. Know that line can sometimes come up quick if there's some outside external force on you, whether it's somebody assisting you into a position or you're wrestling or whatever it is, that could move your body into a place where it could cause injury. I just think if you're hypermobile and you're thinking about a joint that's already has more mobility, you have to be aware of your limitations and also spend time training motor control and strength through that full range of motion. That's the other thing too, is that sometimes you hear people say, whatever mobility you have, I think you need to train through that range of motion. 100%. Right? You can't skip portions of the range of motion, but you'll hear some people say that because they think, ooh, this person is moving too far outside of a normal, like that normal range of motion. They shouldn't do that. But this is just, many people are born with that. They just have extra mobility. And so I think you're doing a disservice to them if you don't help them learn to control that entire range.
Yeah, you're so right. And I think it's how we control that range, because we often use weight in our daily life, for example, carrying shopping or lifting our kids up within that normal range. But then we go to yoga and we're stretching outside of that normal range. And I think that perhaps what we need to do is that's why I love lifting weights, because I really try and work my full range of motion out, right to the end of what I'm capable of, but holding the weight, which means that end range is really getting that load to get my nervous system to work at a higher level. So I'm just wondering if like we need to obviously change our approach and how we look at range and load and the whole practice. I feel like there's a big evolution that needs to happen.
Yeah, I agree. I think it's nice to see. I mean, since the years I've been on social media, I think it's changing, and it's cool to see people adopting different beliefs with movement. And I think back to the early, 10 years ago, people thought a lot differently about these kind of topics. And so it's always encouraging to me to see these, like I say, people just their beliefs are changing. And I think more and more people are thinking about it this way of, what's the person's sort of intrinsic sort of movement like? And if you think about something like hypermobility, that's not necessarily bad. I still have lots of students who think being hypermobile is bad. They think it's, and I have to spend a lot of time just helping helping them realize that we just are all variable in our movement capacity. And it doesn't necessarily, if you're a little stiffer or you're a little more mobile, that's just you. It doesn't necessarily mean that's bad, and maybe the way you target your body is a little bit different, but we have to stop thinking about that as being a bad thing.
Yeah.
So,
I think it's just our approach needs to change.
Yeah.
Once you give the person the right foundation and you build the house, it's going to be strong.
Yeah.
Yeah.
And it is often that whole like grass is always greener, because it seems like everybody that's like not very flexible, people, they always want to be more flexible, and then you've got the hypermobile people thinking that, oh, I'm hypermobile and that's a bad thing, and it's like, come on, like just appreciate what you've got, do the best with what you've got. And
I think if I had to choose, I like being on the mobile side, and just as long as I can control it. I mean, so if there's people out there that feel down about being hypermobile, and obviously there are some diseases, connective tissue disorders and things where people are really hypermobile, and so that's another discussion. But I think if you're just sort of like the average kind of person and you're more mobile, I mean, I've always liked being on that side. I think it has a lot of advantages. You just have to learn to control it.
Yeah,
totally.
That's kind of, I hope that's helpful.
It's been incredibly helpful. We think you're really, honestly, we think you come from such a good place, like really evidence-based, a lot of experience. We are so grateful that you've decided to have an interview with us. And I know our followers are going to be really grateful as well, Tom. So your time meant a lot to us.
Oh, happy to do it. Thanks for having me on. I'm glad it finally worked out. And I'll email you those article links and that image. So I think it'll be helpful to people that sort of, it's so nice to have a visual, I think, sometimes to kind of grasp these kind of ideas about the stability and mobility in our body and what sort of factors are contributing to that. So
for sure, and we'll share those with our community on our Facebook group.
Yeah,
cool. All right, awesome.
Yeah.
All right. Well, have a good rest of the day. Thank you.
Hang on one second. We'll just end the meeting first.
Oh yes. Okay, perfect.
Stop. Yeah.